Alright, so you guys are already enrolled in Medicare, got that red, white, and blue card, or it's on its way. So let's go and figure out what Medicare covers. Alright, so Medicare covers all medically necessary services. And the way Medicare does their coverage guidelines is a little bit tricky. So basically how they do this is there's medically covered services, there are medically covered diagnoses, and in order to get to the diagnosis you have to first get tested. So your physician will have to figure out what he thinks or she thinks you may have, and then have a test that is correspondent to that diagnosis, and then treatment plan that is correspondent to the diagnosis here. So basically you don't need to be an expert at Medicare coding, but you do need to understand that there is protocol. Now, how does Medicare work? How do you use it? Is it accepted everywhere? Does no one accept Medicare? Well, this video will go over how to find out if you can go to the doctor or the hospital with Medicare. For the most part, Medicare is accepted by most of the physicians in the entire United States. You can check by going to the Medicare.gov website, and I'll link in the show notes down below for you to go and check if your doctor accepts Medicare. Most hospitals also accept Medicare, and most pharmacies accept Medicare as for Part B services, as well as Medicare is one of the top payers of healthcare in America. Most clinics, hospitals, and medical providers do accept Medicare. Under Medicare, you do not need to choose what's called a primary care physician or a family doctor. You do not have to designate someone as it is. Medicare works kind of like a ATM card, where as long as you go to a service provider who accepts Medicare, you can get seen. There's no need for a prior relationship, establishment, or anything like that. You just have to be able to get on their schedule. So same thing goes for a referral. A lot of people ask me, hey Matt, do I need to get a referral to see my cardiologist or my pulmonologist or maybe an oncologist? And the answer on original Medicare is no. Because it works like that ATM or credit card, you just have to go show them your card and pay your respective coinsurance or copay, and they can see you. There's no insurance company per se to process a referral. Now, important to keep in mind though, especially where I live in Hawaii, where the doctor community is fairly close-knit, even though you don't need a referral for insurance purposes, you may need a referral before seeing a specialist, because the specialist wants to know what is going on with you, so that the specialist can do some research and figure out how to best serve you when you come to the office. Now, things to remember on original Medicare and how to use it: there are deductibles, copays, and coinsurances on the original Medicare program. While Part A has no premium, Part B does have a premium, so you do have to pay for that. And in addition, you have to pay for whenever you utilize services. What can you do to minimize or have those costs be more predictable? Well, you can purchase what's called a Medicare Supplement Plan or Medigap plan, and those things would cover your specific needs based on your needs. I'll go into that topic in a little later video, but just know for now that there are supplemental policies you can purchase to supplement your Medicare. So how much do I pay for my Medicare services? Well, if you're in the hospital, you pay a one-time $1,408 deductible for a period of 60 days. After that period of 60 days, you will have to pay $352 per day from days 61 through 90. And after that, you may be responsible for 100% of the hospital portion. For Parts B, there is an annual $198 deductible, and then you will pay 20% of all Medicare approved charges. So the scary part about Medicare, and the reason why we as Medicare advisors ask you or subscribe to you or prescribe to you Medicare supplements or Medicare Advantage, is because there's no maximum out of pocket. Many of you folks coming off of your group plans may have a maximum out of pocket of somewhere between $5,000 to $10,000 for a calendar year. Under the original Medicare program, after the $198 deductible, you could potentially be responsible for 20% of an unknown amount, which, as many of you folks might imagine, medical services can be quite expensive. One of my clients who is a physician, he actually had double knee replacement surgery in 1 year. Now, fortunately for him, he had supplemental coverage, which covered 100% of his out-of-pocket. But with his particular circumstance, his coinsurance under original Medicare would have been upwards of $40,000. So, lucky for him, he had insurance or supplemental insurance, which covered that gap. So that's kind of how Parts A and Parts B work. Part D is a completely different animal, and we have a specialized topic or video for that coming up. But for now, that is Parts A and Parts B. So now that we know what Parts A and B do cover, let's dive deep into what A and B don't cover. There's two important distinctions. The first distinction is the financial portion. So as we said in the prior video, Parts A and B do have deductibles, copays, and coinsurances. So what a Medigap policy or Medicare Supplement policy do is they cover those gaps, the financial gaps that Medicare does not cover. They do not cover things that Medicare does not cover. Now that kind of was confusing. Basically, if Medicare doesn't pay for a service, a Medicare Supplement Plan in most circumstances will also not cover it. And it's not because the Medicare Supplement Plan doesn't want to pay, it's that they are constructed and engineered in a way to pay just for that coinsurance, copay, and deductibles of original Medicare. Now that second part is the part where you might be thinking, what? I don't get dental, I don't get vision. Well, Medicare Parts A and B don't cover the following, and this list is not all inclusive, but they don't cover things like routine vision for eyeglasses. They don't cover most dental work. Also, with Parts A and B, you don't get a drug plan. You have to purchase a separate drug plan for that. They don't cover long-term care or custodial care. So now we know what Parts A and B don't cover. What can we do about those things? Well, for the most part, dental insurance and vision insurance can be purchased. There's also dental and vision discount programs that can be purchased. I have an entire series on the supplemental part of Medicare for this purpose, as there's many differences, and in certain circumstances, sometimes it's better to not purchase the insurance for dental and vision if you don't actually use it. Now for long-term care, as many of you folks know, long-term care insurance can be purchased on the side. There's Medicaid, which can also cover long-term care services, but that's a completely separate topic, and I have a video series on Medicaid itself. All right, so that's what Parts A and B don't cover. Now I know it's kind of strange that I'm introducing in the next video Part C, even though we've already skipped C and went on to D, but I feel like this is the best place to talk about Medicare Part C or Medicare Advantage plans coming up next. Medicare Advantage plans are bundled plans that include all the services of both Parts A and B, and most times Part D, and are offered by private insurance companies. While these programs are an alternative to original Medicare, you still have Medicare. They just don't operate, or they don't administer your benefits. What happens is Original Medicare pays the company that you enroll in order to take care of you. Medicare Advantage plans cover all of the Medicare services, but they charge different copays and coinsurances and may have different coverage guidelines that you have to follow first. Now, these services or coverage guidelines can be things like getting a referral. On the Original Medicare, you don't need a referral. Maybe getting prior authorization for certain services, even though on the Original Medicare, you could get the service without getting a prior authorization. So those are the kind of things that we mean by have different rules and guidelines, and also the copays and coinsurances can be different. For certain Medicare Advantage plans, they may do a per day cost for the hospital versus that one-time deductible. So what are the costs for Medicare Advantage? Well, Medicare Advantage plans come anywhere between negative, meaning that if you join the plan, you could actually get a Part B reduction, or upwards of $100 or maybe even $200 per month for this plan. Now, the costs are going to be varied depending on which company you go to, your county, and things like that, if you choose a PPO versus an HMO. And those are very important when looking at the costs for Medicare Advantage plans. Another thing that you really need to look into when purchasing or shopping around for Medicare Advantage plans is their network. So unlike Original Medicare, which you can see any provider in the US who accepts Medicare, for a Medicare Advantage plan, you actually have to look into the particular plan's network to find out if you can go ahead and see that physician, go to that hospital, go to the physical therapist, etc., because they have a contracted network, and it's typically a local network. So if you need to travel and you have a Medicare Advantage plan, please look into the coverage guidelines as far as receiving care outside of the network, and also consider picking up potentially travel insurance to cover you while you are away. So what is a Medicare Supplement Plan? This is going to be a super short segment. Medicare Supplement Plans work on top of Original Medicare. So you still have Original Medicare as your primary insurance. You have a Medicare Supplement Plan as your secondary or supplemental insurance. And what that allows you to do is to remain on the Original Medicare network, which is the largest network we probably have in America. It includes most of the physicians and most of the hospitals in the US. Original Medicare also will allow you to go to any physician without a referral, and the coverage guidelines for Original Medicare are very transparent and are online. So you don't have to navigate through the private insurance company's coverage guidelines to receive care.